I want to know, how long does this one session last, and how long am I going to feel the energy for? I mean, usually.
Welcome back with my left hand.
Oh man, usually we have a thing where we shake hands, but
I can't even shake your hand right now. So
I'll just wave. Okay.
Dr. Ritu, welcome to the show, and thank you for opening up the offices for us.
Thank you.
This is my partner Rahul. My name is Karnvir. Can you give us an introduction to yourself and just tell us what's happening today?
Yeah, my name is Ritu. I am a naturopathic physician. I run Terra Medical here, and I've been in practice for 10 years now. My education was Calgary, Arizona, Seattle, and I've been here since 2016. Today we are doing nutrient IVs. These are filled with all vitamins, minerals, B vitamins, amino acids, and then hopefully, if you guys agree, we'll give you a B12 shot at the end to help boost your energy.
Oh wow!
Yeah.
So these are just right off the bat. I want to know, how long does this one session last, and how long am I going to feel the energy for?
Yeah, so it lasts for about 45 minutes to 50 minutes, the actual session. How long will you feel good for? So depending on how depleted you are, you may not get too much of an oomph, even just with the first one. So if patients are really depleted, sometimes we have to build them up with 2 or 3 IVs. And then after that, once the vitamins and minerals are built up in their body, then it starts to last long term. So if you feel good just for one day and then you're back down, that means your body's really depleted, it used up all the nutrients, and it needs a little bit more. But if you feel good now for the next little bit, that means your body is up to par. And you know, some patients go 1 month, 3 months, 6 months, 8 months without having another one.
Okay, so this is not something regular that we're doing every 2 weeks or something?
Some patients are, so it totally depends. Pain patients do it because it helps with pain. Cancer patients do it. It helps with side effects from their cancer drugs or chemotherapy, or helps recover from surgery. People who have iron deficiency, they bring their levels up and then they're good for a few years, but then they have to come back down if their levels decrease. Athletes, if they're training hard, they need the hydration, they need the muscle repair. They're in more often, especially the ones that compete on like a higher level. Yeah, so kind of every patient's a little bit different. But the average Joe that walks in the door, maybe once every 3 months, once every 6 months.
Right, so Karnvir now.
Yeah, there you go.
So I'm a vegetarian. I'm a vegetarian. He's a meat eater.
Yeah.
We're both fairly active with working out, taking like outdoor activities.
Yeah.
Right?
Yeah.
So something like, for me, for a vegetarian versus him, what's the difference that's going to happen?
For you, I would recommend more amino acids because maybe you lack a little bit less or lack a little bit protein compared to him.
Yeah.
Maybe he's getting the daily requirement of protein and maybe you're not getting as enough. The other thing is iron is a big thing for people who are vegetarian.
Okay.
Everyone that's vegetarian is iron deficient.
I know. I hear it all the time.
Yeah.
Yep.
So iron we can't add into these bags. It's a separate IV. We have to be a little bit more cautious with it, but it works great. And once your iron levels are up, they last years and years and years. With this, you got to continue coming in every 3-6 months whenever you kind of feel like you need a boost. With iron, it can last years even, especially in men. Yeah. So that would be the difference between like a meat eater and a non-meat eater. So the amino acids we put in for a lot of times vegetarians whose diet does not have enough protein, we add more amino acids to it.
That's interesting, because as a vegetarian, I'm always looking for alternatives in food, maybe supplementation, to make sure I keep my iron levels up.
Yeah.
So let's say I am doing everything right. I'm eating all the right things. I am taking multivitamins.
Yeah.
Is this something that is practical for me to take?
Oh, 100%. The thing with this is you don't have to take the multivitamins. So I'll give you my kind of situation. I'm also vegetarian, but I don't take any supplements. So I top myself up with these. I top myself up with the iron. Then I'm not having to like push pills. The difference between this and pills is this is getting 100% absorbed into your body right now. It's going right into the blood. When you take supplements, what's happening is it has to surpass your digestive tract in order to absorb those nutrients.
Yeah.
And if you've got like anything going on with your digestive tract, any inflammation, sometimes the capsules are not made well. There's a lot of fillers, chemicals, artificial things in them that your body doesn't even absorb those vitamins. So I always tell patients a multivitamin is sort of like the worst money you can spend. First of all, they use very little quality of very little quantities of all the minerals and vitamins.
Yeah.
So you're kind of getting a little amount in every pill, and then we don't know how much you're going to absorb.
Right.
Yeah. But something like vitamin D, you should take every day because that's easily absorbable and we don't get enough here.
Yeah.
And there's also no vitamin D in there. Vitamin D comes as a shot.
As a shot?
Yeah,
Okay.
yeah.
How many people pass out with stuff like this? I'm feeling lightheaded.
Are you really?
Yeah.
Should I give you a little juice box?
Sure.
Why don't we do this? Why is it just the thought of it?
Yeah, I think it's the idea.
I'm gonna run and get some juice boxes for you guys.
Yeah.
Yeah, give me 1 second.
Yeah, I feel lightheaded.
Feel powerful. You feel any pain or not?
No, it's not pain. It's like I'm feeling like I'm starting to get a little bit like uneasy in the stomach and lightheaded.
I think it's just like the thought of it, right?
It's the idea. Like even with needles, even if
I'm
I
gonna
get
get you to open your straw.
Oh, you
Doesn't know
can.
how to use his hand.
You can move that arm.
I'm so scared.
Okay, do you
Can
wanna?
you just poke it in there for me,
Okay,
please?
yeah. You're okay if I accidentally touch your straw?
Yeah, that's fine.
You're okay with germs?
You're a doctor.
I know since COVID, everyone's like, oh, don't touch me or sanitize or.
Yeah. More than usual. More than they used to.
Yeah,
I think.
we need germs in our life. Keeps our immune system strong. Do you want one, Rahul?
Deeply intelligent. No, I'm fine.
Okay, let's just put it here just in case.
Sure, yeah, just in case.
Did the legs probably help
So what's the
too?
juice do?
Just in case I pull a Karnvir. So one of the questions that you answered that I was going to ask was difference between multivitamins, like ingestibles, like you eat them, versus the IVs. The rate of absorption is higher.
Oh yeah, it's 100% because it's going right into your bloodstream,
Right.
which is nice because then your body utilizes all of it.
Right.
Anything you ingest orally, you don't know how much you're absorbing.
Right. When there is an abundance of supplements in your blood,
Yeah.
does a big portion of that also get excreted out? Like your body's like, oh, this is more than we need.
No, so only the water soluble ones do.
Okay.
The other ones our body stores and uses. So something like B12, if we give you a B12 shot and your body has enough of it, it's water soluble, so your body will take what it needs and you'll pee out the rest.
Right.
Yeah.
Is that why when I take B12 that my urine color changes
Yes.
to yellow? Okay.
Yes.
So is that what's giving it this yellow?
Yeah, so that's the byproduct. So even after these IVs, because we put B complex in it, the B complex is giving you that yellow color. If you were just taking a B12, your urine would turn red if you had too much in your body. But the yellow is the color of the B complex, and it's the byproduct that comes out in your urine. So you don't want that part to be absorbed in your body.
Right.
Karnvir, how are you feeling?
I feel good now.
Okay.
It's like it just came
Yeah.
and it just like went away.
How's the temperature in here? Do you guys want me to?
Temperature's great.
I like the temperature. I like it a little bit colder.
Do you want it cooler?
No, I think I'm fine for right now.
Okay.
Yeah.
See.